she's out of the home.
That's correct.
She's on her own.
Mm-hmm.
You still worry about her?
Oh, absolutely.
Still concerned about her?
Love her.
You still love her, and you will no matter what happens,
Exactly.
true? Abby,
Absolutely.
true? I mean, you still love her. Do you miss her?
Yeah,
You miss her, you don't miss the disorder.
right. I miss the sweet side of Jennifer when she can be nice.
And Erica, there's sweetness with Meagan, is true, right? We've seen it here. She's on her best behavior today.
Yeah, her best behavior.
She's in her victim posture today, right? Okay. So, I mean, that's where we are. What do you hear these guys saying to you?
That we need to let her have her own disease and not control our family, which she has done for 10 years. And we need to have our life back. And watching what you went through is identical to what we're going through. I mean, our dishwasher broke and I never replaced it because it was a hiding place for food that she wouldn't eat. She doesn't even know that.
You see, you make special rules for the disorder. It's like let's have a meeting and see how we can make this disorder possible for her to live.
Exactly.
I mean,
That's it. Exactly. We're trying to make her live with her disorder.
And that's how we contribute to it, though.
That's right,
That's
we're
what I realized.
enabling
That's
her.
how we contribute to
Yeah.
it, and it's the smallest. That doesn't mean that's not, loving her is not enabling the disease. You still love her. I talk to Jennifer 2-3 times a day, but we don't talk disease. So the smallest thing, you have to decide what you do to contribute to it. It's the smallest thing. Buying special mustard, buying special dressing, let her in the home. That's enabling.
Yeah.
Loving her is not enabling it. That's what I've learned was the difference. We don't like the disease. We don't talk to the disease. It's like an abusive boyfriend. We don't like who she's dating. It's not allowed in our house. But we'll talk to her and find out what she's doing in her life. Encourage her, keep her going forward with it. But that's where we learn, that's where we listen. We just didn't hear, we listened to people with good experience and good knowledge and helped us a lot. And once we became strong, that support is what keeps you strong.
now, we actually arranged for Jennifer to go to treatment,
Yes.
and she got in treatment. She began to make some progress, and then she dropped out of treatment. She quit, walked out the door. What was her excuse? Or justification?
We
or whatever it was.
didn't listen for the excuse because then that would be giving the disease some of our attention.
Right. Dr. Michael Barrett is here. He is the president and CEO of the Center for Change, which you talk about the cutting edge program for dealing with this sort of thing. Dr. Barrett, first, thank you for being here. And thank you for what y'all do for this very, very difficult population. What can you tell us about this situation? I don't want to violate anything, but we do know that Jennifer quit the treatment and moved on. What can you tell us about this that we can learn for all of these situations?
What I can say is, like you said, it's a marathon race. It takes a long time, sometimes years. And people with this illness need to get in treatment. They need to stay as long as they need to. If they fall out and they relapse, they need to come back. And they need to never give up. And if they will not give up, they will get well.
Well, that's what I want people to understand. I've said this is a severe mental illness that you're dealing with here. But these people can and do get better, correct?
Absolutely.
And when they get better, it's a product of what? I mean, obviously, it's a lot of long and hard work, but there are many components to it.
Perseverance, dedication, telling the truth, facing fear, and coming back when you're scared.
Now, this family, in my opinion, motivated in love. I'm not trying to throw you under the bus here, but we're talking here about a very enabling situation that has set up special rules to support this disorder. How destructive is that?
It is destructive because kind of accidentally you keep it going. Or you create an environment in which it can dwell, is one way to say it, despite your love and best intentions.
Do you have a story or a question for me? Click the link in the description and tell me what in the world is going on.